Canada's Express Entry Healthcare and Social Services category is designed to attract skilled professionals in the healthcare and social service sectors to address labor shortages in these critical fields. Candidates must first be eligible for one of the three main Express Entry programs: the Federal Skilled Worker Program, FSWP, Federal Skilled Trades Program, FSTP, or Canadian Experience Class, CEC. Once eligible under one of these streams, applicants must meet specific criteria related to work experience, job classification, and language proficiency to qualify for the healthcare and social services category-based draws. One of the key eligibility requirements is having a minimum of 6 months of continuous full-time work experience or equivalent part-time experience in a qualifying occupation within the past 3 years. This experience can be gained either in Canada or internationally, provided that the occupation falls under the designated list set by Immigration, Refugees and Citizenship Canada, IRCC. The eligible occupations include a broad range of professionals such as physicians, registered nurses, licensed practical nurses, paramedics, physiotherapists, pharmacists, occupational therapists, social workers, and other healthcare-related professionals. These occupations are classified under the National Occupational Classification, NOC, system, which ensures that only those with relevant expertise are considered. Apart from work experience, candidates must meet other express entry requirements, such as language proficiency, education, and proof of sufficient settlement funds, unless they are already working in Canada. Language proficiency is assessed through tests such as IELTS, CELPIP English, TEF or TCF French, with minimum Canadian language benchmark, CLB. Score typically required. Education is also a crucial factor in the eligibility criteria. While some healthcare professions require licensing in Canada, others may need educational credential assessments, ECA, to verify that international qualifications meet Canadian standards. Candidates who meet these requirements must create an express entry profile and indicate their interest in the healthcare and social services category. The IRCC periodically conducts category-based election draws, inviting candidates with relevant experience. These draws may have different comprehensive ranking system, CRS, score requirements depending on labor market needs. Successful applicants receive an invitation to apply ITA for permanent residence, after which they must submit all required documents, including proof of work experience, educational credentials, language test results, and police clearance certificates. The processing time for express entry applications generally takes around 6 months. Canada's healthcare sector faces ongoing workforce shortages, making this pathway a vital opportunity for skilled professionals to immigrate and contribute to the country's healthcare system. Candidates working in critical roles, especially in underserved areas, may have higher chances of selection. The express entry system prioritizes skilled workers who can integrate quickly into Canada's labor market. By targeting healthcare and social service professionals, Canada aims to strengthen its healthcare workforce, support growing healthcare demands, and provide quality services to residents. For individuals in this field, the Express Entry Healthcare and Social Services category provides a direct and efficient route to permanent residency in Canada. By ensuring they meet all necessary eligibility requirements and maintaining a competitive CRS score, applicants can enhance their chances of securing an invitation and successfully immigrating to Canada. Description with hashtags. Canada's Express Entry Healthcare and Social Services category offers skilled healthcare and social service professionals a streamlined pathway to permanent residency. Eligible candidates must meet Express Entry program requirements and have at least 6 months of work experience in a relevant occupation. Occupations include doctors, nurses, paramedics, physiotherapists, pharmacists, and social workers. Applicants must meet language proficiency, education, and job classification requirements. The IRCC holds category-based draws to invite professionals in high-demand fields. This program helps address Canada's healthcare labor shortages, offering professionals the opportunity to contribute to the country's healthcare system. Canada Immigration, Express Entry Healthcare Jobs, Social Services, Permanent Residency, Canada PR, Immigrate to Canada, Skilled Workers, Nurses in Canada, Doctors in Canada, Healthcare Professionals Work in Canada, Canada Visa, Medical Jobs, Occupational Therapists, Physiotherapy, Paramedics, Public Health, Registered Nurses, Social Workers, Pharmacists Canada, Healthcare Pathway, Canadian Experience. Immigration pathways, CRS score, work experience, Canada visa application, PR application, healthcare shortage, immigration updates.
Thanks for watching our video. Please hit the button and subscribe the channel.